Well, good morning, Jaginder Rana here. The topic for our discussion today is health insurance challenges. Health insurance challenges. Chronic kidney disease is becoming a crucial public health problem in India. The prevalence of chronic kidney disease is approximately 800 cases per million population, constituting almost 10% of the Indian population. With an increasing number of people being diagnosed daily, there is a dire need for reliable treatment with the help of health insurance for 50 years olds. However, despite the rapid increase of patients suffering from chronic kidney diseases, a large number of them are facing serious challenges in obtaining health insurance. This multi-layered problem must be addressed to improve health coverage for all. So, getting health insurance for pre-existing kidney patients is already a challenge, but getting one for kidney disease patients or chronic kidney disease patients has been and will always be tougher. Before taking the policy, most kidney patients with a pre-existing disease will find it extremely difficult to get coverage. Most policies outright deny coverage or charge exceedingly high premiums while providing limited coverage. Now, many patients wonder what to do when paying for their treatments. On the other hand, inflated costs associated with kidney dialysis also cause further financial challenges for patients. For a chronic disease like chronic kidney disease, these costs can be staggering. As is often the case, standard insurance plans will not cover most of these expenses. However, with the adequate information, navigating health insurance for 50-year-old chronic kidney disease patients breaks the loops in the insurance system. Taking early steps, being informed, and knowing what policies to purchase are key to good health and financial comfort. Patients battling chronic kidney disease can secure insurance coverage, but those policies usually lack all the necessities. Many policies have exclusions, especially ones about kidney treatments. Even if there is coverage, it tends to be very limited. Most policies cover hospitalization, but procedures like dialysis or kidney transplants are usually left out. So this results in patients spending a lot of money on necessary procedures. At times, the expenses from the medication and post-transplant care are also often left unattended, which increases the financial pressure even more. Due to this inadequate coverage, accessing the requisite care promptly becomes a challenge for chronic kidney disease patients. They are forced to confront the financial burden single-handedly, which results in stress and requires treatment. So although there are many challenges, there are ways to expand the coverage offered to chronic kidney disease patients in India. Following are some actionable measures that can help close the gap. Say, for example, search for specialized plans. Certain insurance providers deal with clients suffering from pre-existing conditions, such as chronic kidney disease. These policies may include coverage for dialysis, kidney transplants, and the requisite medications. Albeit at high premiums, patients must conduct background research on these policies and select the insurers that offer the best terms tailored to their needs. And use critical illness insurance. critical illness insurance can serve the payment requirements of those affected by critical kidney disease. Unlike traditional medical policies, critical illness plans covers a predetermined list of ailments, including renal failure. These policies pay the insured a lump sum when they are diagnosed with an outlined critical illness and need financial support for kidney procedures like expensive dialysis and transplantation. Watch for waiting period. The format of some policies might include a waiting period before the benefits of insurance can be claimed for a pre-existing condition like critical kidney disease. This is an important issue that needs to be dealt with carefully. We must scrutinize all details to select the most beneficial plan with a bearable waiting period. A shorter period indicates that the chronic disease can be managed sooner, and therefore the policyholder can start reaping insurance benefits. And group health insurance plans. Many employers offer group health insurance policies which better deal with the pre-existing conditions. You should look at your employer's group insurance policy if you have a job. Group plans usually allow patients with chronic kidney disease to access coverage with fewer exclusions and waiting periods. There are certain government schemes. The Government of India has implemented multiple health insurance programs targeted towards people suffering from chronic ailments. One is the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, which helps reimburse medical expenditure for various diseases, including kidney complications. To lessen the burden of healthcare expenses, one should always find out whether they qualify for these government services. So finding ways to get health coverage for a patient suffering from chronic kidney disease is not always easy, but it is achievable with the right approach. Specialized plans, government schemes and critical illnesses cover options can help manage expenses and provide valuable support in times of need. So, a rationalized GST rate on health insurance will directly reduce the cost for policyholders, encouraging greater enrollment and renewables, thereby increasing insurance penetration. India's health insurance system or ecosystem must pave the way for regulator or policy tweaks to revitalize India's health insurance ecosystem. Discussions are likely to focus on measures that could boost health insurance coverage, which remains below 60 crore individuals. So, premium rationalization at a time of an ongoing debate around GST impact, need for simplified products and a grievance redressal may find mention in the meeting. Despite covering a lower proportion of population, health insurance coverage in India has remained in single digits since the pandemic. The growth was slower than the 5.7% increase in persons with health insurance witnessed in FY23. So before the pandemic, between FY15 and 18, the pace of addition of people under health insurance coverage was higher, at 18.7% per year on an average. Covering 20 crore insurance rise from 28.8 crore to 48.1 crore by financial year 2018. Thank you very much.